My guest on this episode reminds us that advocacy is an act of love and that courage often means showing up, speaking out, and refusing to accept a broken normal. She shares how leading with hope, truth, and fierce compassion fuels her work for public health, education, and democracy. This conversation is a rallying call to stay bold, stay kind, and keep building a healthier, stronger, more just future. You're listening to the Courageous Public Health Podcast, Episode 5. To all the courageous Black, Indigenous, and women of color leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I'm an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have unfiltered conversations with BIPOC women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then let's dive into this brand new episode. Thank you for joining me on this episode. I'm so excited to introduce you to my guest. But first, I'd like to reintroduce myself if you're brand new to the podcast, or reintroduce myself if you're a returning listener. My name is Dr. Christy McClamrock, and I'm an epidemiologist, public health entrepreneur, and the CEO of the Courageous Public Health consulting firm. At Courageous Public Health, we are turning up the volume on courage within women, particularly Black, Indigenous, and women of color, who are doing the work of public health. We support public health organizations through workshop design and facilitation and speaking engagements. Be sure to subscribe to the Courageous Public Health Podcast email list. The link will be provided in the show notes. I'm so excited to introduce you to my guest on this episode. Let me formally introduce her, and then we'll jump right into our conversation. Chris Chanyasulkit, PhD, MPH, is a public health practitioner, advocate, keynote speaker, and master connector who speaks both nationally and internationally about public health, literacy, civic engagement, and racial, gender, and health equity. She is a past president of the American Public Health Association, a mom of 3, a dog mom of 2 pups, and an avid reader. Let's connect my conversation with Dr. Chris Chanyasulkit right now. Hi, Chris. Welcome to the podcast. How are you?
I am good. I am here. I am really excited. Thank you so much for inviting me. Thank you.
It's really my pleasure. I've been very much looking forward to this conversation. I want to start by having you introduce yourself, and then I'm going to say a little bit about how we met.
Okay. So my name is Chris Chanyasulkit, very long last name. And I know I met you because we were at the Women's Leadership Institute at the American Public Health Association, APHA, where I am one of the past presidents of APHA, which is always surprising for me to say, and then I think surprising for some folks to hear, because I don't look and sound a lot like our presidents of the past 150 years of the association. But I'm really thankful for that moment, that honor, that ability to do that work, but also because it's allowed me the opportunity to meet folks like you and other great friends that I've made. And so aside from having traveled around the nation advocating for public health, I'm also a public health consultant, and I'm here in Brookline, Massachusetts, which is right next to Boston. And I do a lot of my work online, different places. I travel a lot. And I like to joke that I'm a carpool mom because I feel like now with my 3 kids, I spend a lot of time driving people places. So I do a lot of that. It's public health, it's being a mom. And then right now, I would say with all of that, I am doing a lot of advocacy, whether it's locally or nationally, because I think, unfortunately, now more than ever, it's critical. So I would, I am a big champion like you for public health, and we need to just get out there, be, more vocal, more strategic. And then at the same time, my worlds are colliding. I'm a big library supporter, literacy lover. And I'm out there trying to advocate also for our libraries, our freedom of speech. It's been crazy because both sides of my world, whether it's public health or libraries, are all really, I guess I would just say I'm an advocate right now, because every day just seems like all I'm doing is advocacy. It's good. I just wish that things weren't as critical as they are.
Yeah. Oh my gosh. I love that you love libraries. I love that you love reading and you love books. My mom was actually, oh, look at all your books. I also have a lot of books behind me. My mom was a elementary school librarian for many, many years. And so she taught me to love books and to love libraries. And there's such special places, and the idea that certain books are being banned, that we can't, people can't access them. It just blows my mind. It's like, I thought we were so far from that. I didn't imagine that was going to come up again.
I know. In the United States.
United States. Yeah. Exactly. So anyway, I share your love of libraries, for sure. And yeah, you mentioned that we met at the Women's Leadership Institute, and that was the day before APHA started. And I had actually messaged you on LinkedIn ahead of time. I did. I wanted to introduce myself, and then we both ended up sitting right in the front row. And so when I can't remember who led this, but there was a moment where it was like, okay, turn to the person next to you and have a conversation about, whatever it was. And it was like, oh, hi.
I know. And it was really great. And I'm excited. I'm actually on the planning committee now for the next Women's Leader Institute. They invited me, which I can't wait, because I was like, we're going to go bigger and better. And I was telling them, about some folks like you that I had met that I've now continued to communicate with throughout the year. And it's been incredible.
Yeah.
And so I was just like, oh yeah, you want me to be on your committee? I'm happy to do it, because it has been really impactful for me. We've done it 2 years now. I've gone 2 years. I loved it. So I'm ready to go for the 3rd.
Yeah, we should talk about that later, because that's something that I would definitely be interested in. That's exciting. That's exciting. So I want to jump right into the questions. So the first question I have, since this is the Courageous Public Health podcast, is about courage and action. So, I like to remind our listeners that bravery is taking action without fear, while courage is taking action despite fear. And I would love for you to share some experiences from your life, whether it's your professional life or your personal life, experiences where you have acted courageously.
So first, thanks for that framework. I feel like I'm going to steal it and use it with my kids now, and borrow it all the time. Because, that happens, I have a daughter and she has gymnastics meets. I have a son and he just had a soccer showcase, or, things like that. Or my other son was entering a robotics competition, and everybody has the things that they may be nervous about. And I don't think at the time I thought of myself as brave or courageous in doing any of these things. Mm-hmm. It's more like, okay, now she's sitting down and asking me this question. But in looking back, I know there were serious moments in time where I was like, what have I gotten into? How can I stop this? I am literally visibly shaking and sweating, and I don't want to keep going. But I guess like one instance that came to mind right away is that I ran many years ago for town meeting, which in my town is our legislative body. We vote on the budget and policies and warrant articles, they call them, which are bills. And there are a little over 200 of the elected town meeting members in our town that makes up our legislature and that votes. But you have to run, even though it's an unpaid position. And your neighbors vote. We have the different precincts and they vote for you. And you usually, standardly, it's a 3-year term. We have 15 town meeting members per precinct. This was years ago. I was in graduate school. This was before I had children. And a really good friend, best friend who I look up to, was like, she's running, we should run. And then a professor of mine was like, you absolutely have to run, because that's how he got started in politics and governance and making a change in the world. And I obviously had no thoughts or aspirations. He went on to become 3-time governor of Massachusetts, Governor Dukakis, Michael Dukakis. And then he ran, as we all know, for president. And he was a professor of mine, and he also was like, run. And obviously I'm not running for, president of the US or governor of Massachusetts. But for me, town meeting seemed that big at the time when he and one of my best friends said, let's run. And I was like, oh my gosh. And you had to make flyers and answer questionnaires and sit in front of neighbors and folks in different, meeting rooms for candidate forums where people would ask you questions like, why you? Why not this other person? I had to door knock, like just knock on people's door, which is something I do not do. I had to really get out there. And then I had to stand in front of my poll for a good 12 hours or whatever it was, going up to people and saying, oh, hi, I'm Chris, please vote for me. And here's why. And that whole process, it was probably like about maybe 6 weeks or something like that in total, leading up to the election. I was really scared because you have to talk about yourself and promote yourself. I'm so much better at promoting, say, you or your friend or your child or whatever, than to just talk about yourself. And then to ask them to do something for you. Like, granted, they don't have to give me money or whatever, but in this case, they had to take the time to go and vote.
Right.
And everyone's time is precious. And also, I was going up against a lot of really long time incumbents who had been town meeting members and or lived in they and their families have lived in this town for generations. I obviously haven't. So I remember clearly going to, and running, and it was hard and scary, and I didn't know why I was doing it. And some folks didn't say the nicest things. And I remember going back home and crying. But I won, and it was really incredible. And so now I try to tell everyone I know to run, because I know that it is super scary, terrifying at times, and may not seem worth it. But I know that if you don't run, you can't win. And a lot of times, whether it's for your local office or other different things, a lot of times, unfortunately, a lot of folks have to run once, not win, and run again for name recognition and all these other things, or just like to build up their campaign skills. And for me, it was a good thing. And then later I ran, and now I am so thankful to have won townwide. I ran for library trustees. So I'm an elected member of our library board. And right now, as libraries are under threat, I am so thankful. I've always been thankful to be in this position, but really thankful for that moment that led me to this moment. Because I would have never run townwide if I hadn't already done sort of other runs, and I just think, and it was terrifying. I remember clearly not having folks campaign against you and folks not being nice, and saying mean things and yelling at you. And I get it. It's not fun. It's not nice. It's not, but you have to do it. And I say this right now because I really want everyone listening and everyone who's not listening to send, or everyone who, just everyone everywhere.
Yeah.
And then send this far and wide. If anyone thinks that they want to make a difference, whether it's on their school committee, their town council, their select board, be an alderman, volunteer for their board of public health or get elected to it, whatever it is, or bigger, maybe you should be a city councilor, you should be mayor and higher. I want people to run. Not just because it's scary and I know you can do it, but also really because a lot of times incumbents continue to do the things that they do because no one runs against them, no one challenges them or pushes them to do the things that maybe their constituents want them to do something else, right? There's no accountability. Many places all across our nation, every city and town, there's a lot of positions where there's no one running against someone, or a lot of times it's whoever puts their name on the ballot gets to win because no one's running. And I understand, why that is for many other reasons, but I would love it if people could win because it could run to win. Because, just today I was talking with a good friend and colleague, and honestly, it's policy is the way to make change. We are dealing with whatever we are dealing with now in the society we are because of the laws and the governance that we have. And if we want positive change, we need to be there to make that positive change.
Yeah, I agree with you so much. And when I really started thinking about courage and really like diving into courage, it occurred to me that public health is all about courage, because the change, you got to have courage to create change. And, I think those things are intertwined, right? And I love that you ran. I love that you had that experience. I can definitely relate to the difficulty in talking about yourself, that it's easier to talk about other people, to build up or lift up other people, than it is to lift up yourself. And I have to say that that's something that I've really been working on. And it sounds like that's something you've had to work on too, because you're in your later positions, like you got to be able to talk about.
But it's hard. And I will say, I know for a fact I didn't get to wherever I am and do the things that I did without Casey or Governor Dukakis and all these people saying that first time you need to run and supporting you. I literally had neighbors who also stood outside and helped me pass out flyers, and friends who knocked on doors with me. And for everything, if you can find your family, it doesn't have to be, your born into blood related family. It can be your chosen family, to help you. That will make all the difference.
Yeah. Beautiful. I also, you started out talking about, your kids and like going to a gymnastics meet or some other thing. And, I think that distinction between bravery and courage is one that was never made for me when I was a kid. And as an adult, it's helped me so much to understand, like, I don't have to not feel fear. The goal is not to take the feeling away or change my feeling. But my behavior doesn't have to be based on that feeling. Like, I can have the feeling and I can be like, yeah, and I'm going to still do the thing. And so I've been trying to instill that in my daughter as well. Right. That it's, cause actually I think it's like kind of invalidating to say like, well, don't be afraid. Like,
that's ridiculous.
That is so ridiculous.
Very unhelpful.
And your body, like you said, it's like you're sweating and you're like, your heart is pounding, and, but that's okay. Like, we can still do the thing. So I'm really excited that you are on the board for the library. What is it again?
It's the Public Library of Brookline is our library. Okay. We have 3 libraries in our library system, and I am one of 12 elected members to our board that, helps structure the budget and supervises the library director and things like that.
That's really cool. That's very cool. Okay, so I also feel like courage isn't just about taking action despite fear. It's also about claiming and expressing your power, especially in spaces that may not always welcome it. And I'm curious how you express and embody your power as an Asian American woman doing the work of public health.
Wow, that's a hard question. So
Take your time.
The reason why, so I have thought about it for quite a while since you had talked to me about like, hey, can you do this podcast? And told me about it. And I guess I will say, again, I am only myself, so I only have my experience really to share. But I have since learned, met, talked with so many other really incredible rock star women who I look up to, can't wait to be like, want to emulate, that they have just had to be outspoken in times of when their voice needed to be heard because maybe they weren't at the table, or other folks were not at the table, and to be comfortable, or despite being scared, to still say the hard things that sometimes aren't said, to do the things that aren't said, or sometimes, to let people know, that this behavior isn't appropriate at this time and we need to figure out something to do, and to make those hard calls, to call folks and just have a hard conversation. It was so funny. I was talking to a friend. I was like, you're so amazing. And she's like, when you get older, you'll just like, not care. And I'm like, thankful for every year I get older. But at the same time, I'm like, I don't know, will I ever not care? Right. And I think that's just because I was born. I mean, honestly, Asian American, dealing with imposter syndrome, people pleasing, respect your elders, like just all these things together lead me to kind of behaving and being the way I am. But now I started to realize that if I don't speak or someone else doesn't, then those concerns, those values, those aren't being heard, and those aren't being shared, and those stories aren't being told. And therefore, those needs are not being addressed. And we can't continue to go and let things go by. Like, for example, COVID was awful. Like, that's just such a light word to use for it. Tragic. Right. But one thing that I kept seeing in COVID and kept hoping for was like, we'll get out of this and things will be different. And it frustrated me every time people would say, I can't wait till COVID is over so we can go back to normal.
Right.
And I was like, no, normal was terrible. Like, did we not learn that no, everyone, like employer-sponsored health insurance is not healthy for our nation, right? We're in COVID, people are losing their jobs during a pandemic where they need to go to the hospital and get testing and medications and all that. And we're just like, they don't have any health insurance. Like, how is that a good option? So, we realized in COVID, wow, schools and all these things are so important. Kids need to be fed. Schools are where social services are had. Or that libraries, wow, they are picking up the slack for people. They are that extra third, that's the other living room, the resource. People need these things. Or we also realized, unfortunately, in COVID, who we really counted on and who we needed. I'm really thankful for all of us or people who could also work from home. But we realized how critical all of our social services are, our public servants, and I mean that in the sense of like the folks who had to be in town hall and our government to continue to make all of the wheels of the, everything keep moving. And then we realized how important everyone in a hospital was. Doctors and nurses, obviously. I have a sister who's a surgeon, love her, really thankful for her. But also we know that we needed medical assistants and orderlies and people to run the cafeteria. Uber drivers, Instacart workers, all those were critical and essential. And I'm just so frustrated because now we've moved out of COVID more. I don't want to say it's gone because it's still very much here, but for some reason, we still haven't decided as a nation to have single payer or universal health insurance, or I would love it if we could look at GBI, guaranteed basic income. I know that's very, but I think we saw in COVID, if people didn't have actual money, where were they? And that's where all those amazing, like the mutual aids and organizations were, when people needed, I saw it in my town. Someone would be like, I am low on rent. And someone would send them, money or a gift card. And so all this happened, and there was this great awareness. And then it just stopped, right? And so we're, quote, back, but it's not normal, and it never should have been normal, and we didn't learn our lesson. So that's why I feel like we need to keep saying these things, and I need to keep saying them. And also, as an Asian American and a person of color, we need to say these things because, for example, in my town, Asian Americans are the largest community of color at like 20%. But are we as Asian Americans 20% of the governance, of the administration of the town legislature? No, we're not, right? And it's sort of the same thing with all communities of color in their policy making. Who is making those laws that govern them? They should not just look like you, but know you and your needs. So I guess I just do this because I want to make sure that the needs of people like myself, children of immigrants, first person to graduate from college, mother of children trying to deal with carpools, work, and childcare, and the rising cost of childcare. And at the time when my kids were in preschool, I was like, why don't we have universal pre-K? Like, we need all of these folks with these lived experiences legislating and making those policies so we can be not only a healthier nation, but honestly, a stronger, happier, kinder nation.
Oh my gosh. Yep. Yes. Healthier, stronger, and kinder. I mean, and I agree with you. If we don't learn from the COVID-19 pandemic, I mean, what a wasted opportunity, because it was awful. Like you said, it was awful, but it taught us a lot about what is not working, what was not working in our country. And, it is hard to, it's hard to stomach that right now. It seems like we're really not learning those lessons. But I think that, a lot of us in public health, we have learned those lessons. And even if we can't implement the change right away, we will. We will.
Yeah.
Because we'll have the people who speak out and who get into positions of power. And, yeah, we will. We will. So you kind of addressed my last question, but I'd love to see if you have any other thoughts, just thinking about looking ahead and like, what is your vision for the future? And I'm thinking it could be vision for public health. It can be vision for other Asian American women. It can be vision for you personally. What do you want to see in the future?
So, yeah, I mean, I think, so in a previous part of my life, I was a super planner. Like, I had paper planners and I had digital, I loved it. I still make lists and kind of plan, obviously. But I had like all of these plans of things really in advance. And I was, had these ideas of things I needed to do and get done, to the point where honestly, it was not healthy for me, right? Because we as people can only do so much. Mm-hmm. Goodness, I hate it when I hear people say, I'll sleep when I'm dead. But I know why they say that. And I have been at that place, right?
Yes.
But I know now the importance of rest, and rejuvenation and play and reading and taking a walk, or, just going outside in nature. So I don't I plan to an extent, of course, but I often am like, okay, what do I need to do tomorrow? let's, I can't remember everything. So I set my alarms in my phone to remind me, although I set the alarm for the wrong time for this. I'm so sorry.
That's okay. That's okay.
So we have these like systems. They're not 100%, but we try. Right. So we try. So I basically sit down and think about what I want to do and do the next day. I'm thankful for every moment I wake up the next day, right? We just are. And I feel, people are like, oh, I'm getting older. I'm like, that's awesome. What a privilege to live, right? Another year, another revolution around the sun. And so then today I'm like, let's do it. Let's do what I can do the best I can. It might not be great. Yes, maybe, a kid will be late to their gymnastics practice because, traffic or whatever. Like I was just running late and things happen. But right now I want everyone to just do what they can do in that day, in those moments, but also make sure that they take that time to sleep if they can. And I get it. My mom was a meat wrapper and a waitress, and my dad worked at the post office. So everyone had all these different shift schedules. My mom's sleep, she never had enough sleep. So I get it that, sleep is honestly a privilege.
It is.
But I do, for if anyone can, I want our vision of us as a nation to be healthier, to be more understanding, to have some grace with ourselves and each other, to be like, you know what? We don't necessarily need to honk at all the people in the car, on the street or.
Right.
No, and I say this, and I know it sounds really funny in a way, because I do laugh about like, this is your call to action now, but it's more like, I worry that we are running ourselves down, and we need to realize, I'm not a runner, but we need to realize it's not a sprint, it's a marathon, and we need to get there in the long term, to know and to believe, to have that hope, that we will make these small steps that will lead somewhere better. Because honestly, if you don't believe that there's something better, like, what's your point of every day getting up, And I want that. The reason why I say this is because, I work with so many folks who are working in all different aspects of advocacy, whether it's specifically for public health or literacy or your schools. And there's so much going on. And in so many ways, people feel like they're getting crushed, and they can't stop. But to realize that, hey, that's part of the strategy that's out there, is to create this chaos, to bring you down, and don't let it. Remember that you have this privilege to advocate, that you're doing it with so many others. You are not alone. Whether you're a member of APHA, you are there with thousands of other people as advocates, or within your state, in the Massachusetts Public Health Alliance, I know that I'm not by myself, right? And so for that, I take such great hope. The other reason why I am super hopeful and want all of us to realize that, yes, we can do this, is because there were many times in our nation's history where we have probably seen, there were times when people were enslaved, times when women couldn't vote, Black people couldn't vote. There were times when we had folks in internment camps in our nation. There were times when women couldn't open a bank account. Whatever you have. There were times when, children could work in unsafe conditions as young, and all of this took advocacy. And I guess part of it is like, people read your history, right? Don't let them ban your books, because I think we're just like here in this moment, and we need to realize other folks have been in very hard times and they continued on. They sat on the bus. They were part of a movement, and we will be a part of it too.
Oh, I love that. I really, really, really love that. And you said, you used the word grace, and earlier you used the word kindness. And I also hear you talking about like tapping into our joy, right? And being able to use that. I mean, that's what people did in history as well, right? Things were really difficult, and then they would find moments of joy, even, among the wreckage of what was around them. And that's like partly how we get through. So
And people just need to realize, like, I'm not asking us all to go out and throw a party every day. I mean, as much as I'd like to do that. But I'm just saying, like, is it so hard to go out and, like, maybe if you're walking your dog, smile at the person passing you?
Yeah.
Maybe just practice by smiling at their dog, right? Like, I don't know what it is.
Oh my gosh, yes.
But, like, we don't need to walk around with our headphones on, look down, and, like, not have human contact. I just... and it really bothers me when we see people, the whole world is short-staffed. And so there's no reason why, like, you should be thankful you're going in there to buy your drink as opposed to hollering at the barista for taking so long.
Yeah.
You know what I mean? Like, I feel like we need to give each other grace. It starts with us.
Yep.
Be kind. And you know what? The research is out there, like everything APHA. I'm all about science. I'm all about evidence-based research, evidence-informed research. What I am about it. And there is actual evidence-based, evidence-informed research, peer review that shows that kindness does positively affect your physical and mental health and or has an effect to help others. So why don't we do that? I don't know.
You know what? We're doing that.
Yeah.
We're doing that. And I am now excited to see you start the movement of smile at your neighbor's dog. Like that needs to be a movement.
All the time.
Yeah.
It's funny. My husband knows the names of like all the dogs around town, but doesn't know the names of the people. He's just like, oh, Lucy or whatever. And I'll be like, who are we talking about? And he'll be like, the dog Lucy. And I'm like, oh, okay.
Yeah, like, Lucy's owner. What? Oh, the dog. Yeah, okay. That's
somewhere.
Yeah. Oh, wow. Well, I really appreciate you coming on to the podcast so much. It's great to connect with you again after APHA, and I hope that we stay connected.
Absolutely.
And yeah, I'm very grateful to you. Yeah.
Same here. Thank you so much. I was like, whoa, someone wants to talk to me on like a podcast. I told my kids, they were like, oh, really? And I was like, thanks.
I'm sure a lot of people want to talk to you, Chris.
I don't know.
Maybe this is the beginning of
my kids, a lot of times you can see them being like, I'm leaving. They're like, I got to get out of here. I know my daughter had a sleepover this weekend for her birthday. Mm-hmm. And I was like, oh, they're watching Minions. I'm like, oh, I can't wait. And she's like, no, you're not watching with us. And I was like, I haven't, I've met all your friends, but I don't know them. She's like, this is not the time.
Oh, that's so funny.
I will disagree. Not everyone wants to talk with me.
Not everyone. Okay, fine. But you still get to connect with a lot of great people. So that's good. A lot of great people get to connect with you.
I know, but I think it's like the 9 to 10-year-old crowd is a tough one for me.
That's a tough crowd. It's a tough crowd. I suspect that your daughter will come around. As someone who has an 18-year-old, like it gets better. It definitely gets better.
Okay, good. They'll talk to you again. That's good.
Yeah. I actually was able to sit down with my kid yesterday and like have a nice conversation and share stuff with her. And then she said, "Can I give you a hug?" And I was like, what? That has never happened, that I've been talking about, something that is important to me. And then my kid has been like, "Can I give you a hug?" I was like, "Yes, please. I'll take that hug. And I'll pass that hug around."
I know, right?
Yeah.
Yeah, I'm going to start small. I'm not going to tell people to hug random people on the street yet, because that could lead to issues.
Yeah.
But right now, just smile at the dogs.
Smile at the dog. Smile at the dog. Thank you so much, Chris.
Anytime. Thank you.
What an honor to spend this time with Dr. Chris Chanyasulkit. She reminds us that real leadership means speaking up, standing strong, and never giving up on the future we deserve. I encourage you to connect with her to learn more about her and her courage. You can find the links to connect with her on the show notes page for this episode, located on our website, courageouspublichealth.com, under episode 5. Before you go, please take a moment and share this episode with a friend. I know you have people in your life who would appreciate hearing this conversation about courage. If you're listening in a podcast app, you can easily share this episode through a text or directly to social media. On the show notes page, you'll also find social media sharing buttons to make it super easy to spread the word. All right, everyone. Until next time, stay courageous. Thank you for listening to the Courageous Public Health Podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.